Hello everyone. I am Dr. Berkkkaratas. Regarding non-surgical penis enlargement, I usually talk to patients here when they come here. I try to explain it by drawing it on paper. Because it's a bit elusive, I'm also trying to draw on the computer here. I'm going to work, or rather. Now imagine that this is you. And that's me. We talked to each other and decided to enlarge the penis. The first thing we need to do is, of course, to organize our medications, to procure materials, to make measurements and to use some exercises, by the way. Of course, doing these exercises are not exercises. It's not an exercise to lengthen the penis by pulling it like that. This is not true. Exercise that is more about increasing blood flow, which is related to working the muscles of the penis. Let's draw a line. That's what I usually do. I can say this as our first meeting, our first month meeting, our second month meeting, our third month meeting, the fourth month and finally the fifth month meeting. In our first meeting, we do shockwave therapy, that is, after starting the treatment, after the following are organized, and P-shot therapy. We do this in the first month, second month, third month and fourth month. In other words, we have done this 5 times in total. By the way, of course, I mentioned in the previous video, patients use 2 devices at home. One of them is a vacuum device, where we teach automatic vacuums for 15 minutes a day. It's pretty simple to use. Extender, this is actually very simple to use, but it has some special things. You can't use it all at once. I don't recommend using it alone anyway. We use this starting from 1 hour and extending it up to 4 hours a day. In this way, after using them, when our treatment is over, we meet with the patients and measure them again in the 5th month, and at the end of this measurement, we see how much it has grown. How much does it grow? Usually in patients with normal penis size, the growth is between 1 and 3 centimeters. For example, in the United States, they say 100% here and refund it as needed. Of course, we do not do such a thing, but the average is 1 to 3 centimeters. Especially in those with a small penis size, growth is higher. In other words, if you have a 14 centimeters penis, this can be a maximum of 15 to 15.5 centimeters. In thickness, that is, at the thickness of the penis, there is an average growth of 2 to 3 centimeters. That's what the Americans call 100%. We almost achieve these averages in the patients I do, but of course, as I said, it varies depending on the size of the penis. Here, of course, we drew a little badly. I draw more smoothly when explaining to patients. Sorry. Thank you.